hectic life. I have 3 kids at home and a part-time job, and I'm a single mom.
Having the access to these online courses has actually really helped me to be able to do what I want to do and have my goals met when I can also provide for my family.
The nice thing about it is that you can use your time when you want to.
A student is able to go at their own pace, and this is advantageous because in a classroom you're always limited to the slowest or the fastest students, and you're not able to go at your own pace.
One of the many advantages of Galen College of Nursing is that because we're a single-purpose nursing college, that means that we focus solely on one thing: educating nursing students. Each one of our nursing courses consists of 3 components: a theory component, a clinical learning lab component, and a clinical experience component. Our students are able to take the theory portion of the course completely online.
I log in and I look at the lessons for the week. Sometimes you have to write a paper. Sometimes you have to do a discussion posting on a topic that you're learning about. You have to respond to other classmates. So it's almost like being in class, but not having to be in class.
Normally with online classes, I think students often anticipate that it's going to be a lot of text and reading. But what we have done is we've created classes that are very interactive, they're very visual. So it's an experience that you're going into where you're not just this passive learner, you're actively engaged in what's happening.
We actually have lectures just like in the classroom. You can watch the presentations as many times as you need to or want to. It's not like in a class where you just see a lecture one time. You can pause it, you can put it aside for dinner or kids' homework or whatever and come back to it.
In the clinical setting, you put it all together.
It allows the student to take the information that they learn in their online theory class, the skills that they learn in the clinical lab, and they can combine that in the context of actual patient care.
Our students get the opportunity to go out and practice before they're actually licensed. So when you're in the real world setting, a lot of that on-the-job training has already happened.
As a new nurse, you always have that self-doubt. Confidence comes with experience. In the clinical setting, you can be free of that self-doubt because you have a clinical instructor there guiding you and making sure you're doing what you need to be doing.
And also if we have extra questions, the instructors are always here or they respond to your emails very quickly.
A lot of people are, I think, a little bit intimidated at first, but once you go through some of the tutorial material, it's very simple to use.
I would say being an online student is hard work. I would say being a student, period, is hard work, but being an online student makes my life a little bit easier.
I am very grateful to have the opportunity to be able to learn from the comfort of my home and to be able to get the life skills necessary to complete my career and my dream to be a nurse.